and rise to, I think I was very fair, so rise to speak on the Drugs, Poisons and Controlled Substance Amendment Authorising Pharmacies Bill 2023, which of course amends the bill to allow pharmacists to legally administer, to supply, dispense a range of over-the-counter medications that will be available to Victorians and particularly women in this circumstance when we look at the contraceptive pill. Now, the legislation looks at implementing a pilot and particularly looks at expanding the role of community pharmacies across Victoria. And we know the dedicated work that community pharmacies do in all of our electorates. I think we all can say that we have very positive relationships, and particularly, can I say over Deputy Speaker, over the period of COVID, we saw a situation where community pharmacists actually did many of the dispensing, the prescribing of certain medications to free up the health system and free up the GP network during COVID, and was able to do what this legislation looks to implement today. Now, under this amendment, community pharmacists would be able to treat minor skin infections, uncomplicated UTIs, urinary tract infections, and very importantly, as many of us have spoken about today, reissue the oral contraceptive for women. And this will mean that we're expanding healthcare and allied health Victorians and take pressure off our stressed health system here in Victoria. And we know, and I know that the member for Lowen and the previous members on this side who represent regional Victoria have particularly spoken about the fact that in regional Victoria it's very, very difficult to get a GP appointment. It's very difficult to get one quickly when you need it, and this legislation will allow Victorians to use their local pharmacies, work with their local pharmacies to dispense medication for common issues. And it will take that pressure off not only bulk billing GPs but also hospital EDs, which are of course stressed beyond capacity as a flow-on consequence of the pressure on GPs. Now, we've sort of looked at today the benefits of this legislation, and the member for Lowen has put forward a reason amendment that takes into account the opportunity to put some more clinical rigour around this pilot. And we're not saying in any way today that we don't support the objective of this legislation. In fact, expanding access to the oral contraceptive for women was a policy we took to the 2018 election, one that we're very supportive of and one that we've wanted to see in place for some time. But putting some clinical rigour around the pilot, as we have seen as that has occurred in Queensland and New South Wales, where initially pilots have expanded and evolved into clinical trials, making sure that we're looking at the impact, looking at what are the outcomes and what are some of the risks associated with this new approach, and putting that sort of stronger standard around it, that greater structure around this initial pilot, will ensure that we put patients' health first, and then we're also making sure that this is working for our community pharmacists. We, Deputy Speaker, as I said earlier, have seen this approach taken throughout COVID, and as the Pharmaceutical Society pointed out at the time, it was a huge opportunity to test the capacity of our community pharmacists. And when that was removed following the crisis point of the pandemic, it was a recognition that our pharmacists stepped up. They stepped up in terms of providing vaccinations, but they also stepped up as dispensing medications. And we've seen similar pilots take off in Queensland. They've conducted a 2-year pilot and now looking at making this permanent, particularly around the issuing of medication for UTIs. New South Wales has initiated a clinical trial and they're looking at UTIs and to also resupply the oral contraceptive for eligible women. And then further in North Queensland, we're looking at how this can be expanded even further into prescribing medication in what would be called autonomous prescribing and a wider ranges of medications for conditions such as nausea, for looking at how we can look at expanding that for in similar way, I suppose, to other health professionals, whether that's nurse practitioners, optometrists, podiatrists, and this is something that the Pharmaceutical Society has pointed out in the drafting of this legislation, that it is in line with how other health practitioners are able to prescribe medications, and that these regulations are consistent with that, particularly around, as I said, dentists, medical practitioners, authorised midwives, optometrists, podiatrists, and their ability to prescribe medication. So looking at how the regulation can align with that, so we're not creating a separate, I suppose, structure for community pharmacists. This is an opt-in system for pharmacists, and we understand from the legislation that pharmacists will be provided $20 per consultation, and the patients will only pay for the medicines dispensed. And looking at the costings, $19 million has been allocated, and it's expected that probably 50% of Victorians will seek treatment under these new changes. They'll go to their pharmacist rather than the GP during the 12-month trial. And looking at that, it's expected to deliver around over 230,000 oral contraceptive repeats, 130,000 treatments for UTIs, 66,000 treatments for minor skin conditions, and 41,000 travel vaccinations, taking an immense pressure off our GP system for these everyday needs for Victorians. Now, we have heard from stakeholders, the AMA and others, that they do have some concerns around the changes to this legislation. I think what we're proposing on this side around putting in place that clinical trial goes to helping resolve some of those initial concerns, looking at how we can evaluate the impact and the benefits and the risks of this approach. And as I said earlier, the New South Wales and the Queensland pilots and trials have evolved into clinical trials to put that greater structure and clinical rigour around the initial design of this, to make sure that both patients and pharmacists are taking it out. Now, the community pharmacists are under immense pressure at the moment, and largely as a result of the Albanese government's proposal to change the dispensing model from a 30-day dispensing model to a 60-day dispensing model. And we've heard independent reports this week commissioned by the Pharmacy Guild that this is putting at risk 20,000 jobs within the community pharmacy industry, and the chance of over 600 pharmacies across Australia closing. And those will be the pharmacies that are in regional Victoria and putting Australia and Victoria's most vulnerable at risk. We need to be conscious when we're putting in place this legislation that it doesn't impose an additional burden on community pharmacists, their ability to dispense medications, particularly in rural areas, at a time when they're under immense pressure when it comes to these new 60-day dispensing rules that are looking at when they're sort of facing down the barrel of global supply shortages and not being able to meet the prescriptions that they're already trying to service under the 30-day model and shifting to that 60-day model. So it's going to be paramount that there is support for community pharmacists, that they are able to deliver this model. The opt-in design of the trial will hopefully provide them with that support. But, you know, if I turn to a local pharmacy in Kew, and Frida, the local pharmacist, she's so passionate about serving her local community, and throughout COVID she made sure that she was able to deliver medications to those in need, the vulnerable in the community that were not able to leave home. And she's continued that approach, and in a way that does not charge her patients for that. And this model for her will give her greater opportunity to demonstrate her skills and her ability to serve the local community when it comes to dispensing oral contraceptives, when it comes to making sure that UTIs can be treated quickly. And I think everyone would agree that not being able to get into a GP when it comes to a UTI, often many will appreciate when it comes to the oral contraceptive, not being prepared for the next script and going to the local pharmacist will just ease the pressure, not only on our health system, but on Victorians that need to access this medication quickly. So, Deputy Speaker, support the objective of this legislation. It's an important change and one that we want to see implemented, but putting greater clinical rigour around this trial will be paramount for this patient safety.